All right, hi everyone. Thanks for joining us today. You are here for a webinar about osteoarthritis, and our subtitle is Exercise for Self-Management. We'll hope that you learn more about the disease and ways to manage and possibly improve your symptoms. Mostly, we hope that you learn that being physically active actually helps to slow progression, reduce pain, and improve your function if you're living with osteoarthritis.
Hi, my name is Dorotea Cassels. I'm a physiotherapist with over 40 years of experience in hospital and clinic settings. I've worked extensively with persons with osteoarthritis and in particular with hip and knee replacements. I also have additional training in pain science, and I now have a much better understanding that while pain is a warning, exercise done correctly and at the right level is safe and beneficial.
All right, and my name is Wes Pomarensky. I'm a kinesiologist by trade. I've spent approximately 9 years in the field working with multiple different types of people in a range of different conditions. And again, excited to be here and talk a little bit today about osteoarthritis. So just before we start, we want to just use a little bit of a disclaimer that the Wellness Institute is a provider of the GLAD Canada program, which we're going to talk a little bit about more in detail later within our PowerPoint. Many of the images that we use today in our webinar are resources that are provided us from GLAD Canada. To give you a brief outline of how the webinar will look today, we're going to start just by talking about the Wellness Institute, what it is, and what our facility is like here. We'll go a little bit into osteoarthritis and what it is, general symptoms, prevalence and diagnosis of osteoarthritis. We want to talk about risk factors that can lead someone to possibly developing osteoarthritis, and then different types of treatment options. Definitely, we're going to talk about how exercise and physical activity can be very beneficial. And we hope to leave you today with a few key takeaways of what you can do on your own to help, again, treat and manage your osteoarthritis. So this on your screen here is a nice little picture of the Wellness Institute where we are. We are attached to Seven Oaks General Hospital in Winnipeg, Manitoba. The Wellness Institute is a certified medical fitness facility, and we use a multidisciplinary approach to health. So as world leaders in lifestyle medicine, we help to prevent illness, improve quality of life, and enhance outcomes for individuals who have developed a chronic condition, but as well members of the general community here around us. Beyond trying to improve the lives of individuals, the Wellness Institute was created to positively impact population behavior and health. And our goal is to help reduce the demand on healthcare resources. The Wellness Institute runs many programs for chronic disease, including cardiac rehab, pulmonary rehab, stroke and neurological conditions, diabetes, and as we're talking about today, osteoarthritis, and more.
All right. I'm going to talk a little bit about what osteoarthritis is. It's the most common type of all the arthritises. You've probably heard of rheumatoid arthritis, psoriatic arthritis, and those, but osteoarthritis is the most common one that most people complain about. It's a joint disease affecting cartilage, the underlying bone and connective tissue, and it results from biological, in other words, from within, so your age, your hereditary, how you're made up, and from mechanical factors such as an injury or an overload. The changes with osteoarthritis are irreversible once they occur, so it's a lifelong disease, but it can be managed with a whole variety of strategies, some of which you'll learn today. Most commonly, people have osteoarthritis in the hip, the knee, the spine, and the thumb joints, but it really can affect any joint. On your screen, you'll see a healthy versus an arthritic knee joint. It'll give you a better idea of what happens with osteoarthritis. The joint is a connection between two bones, and all the structures within and surrounding it, such as ligaments, the joint capsule that holds all the lubricating synovial fluid inside, and the cartilage that's on the end of the bones. Picture the rubbery white end of a chicken bone. That's what healthy cartilage looks like. It acts like a Teflon coating on the end of the bone, allowing one bone to glide smoothly against the other. In a healthy joint, the cartilage acts as a shock absorber, and the fluid in the joint, it nourishes the cartilage. Think of your cartilage as a sponge. When you compress it or squeeze it, such as when you stand in one place, the fluid is squeezed out of the cartilage, which dries it out and it makes it more prone to breakdown. When you unload or move the joint, the fluid is drawn back in and it rehydrates the cartilage. So think of walking as a repetitive loading and then unloading of the cartilage. And this dynamic loading is very important to help the cartilage regenerate. It's why healthy loads, the right type of exercise, needs to be applied on joints for cartilage recovery and health. Osteoarthritis occurs when there's more degeneration or breakdown than regeneration or regrowth of the cartilage. When it degenerates, the cartilage becomes thin, it cracks, and it might disappear. The bone can then start to rub against each other, and you can get little bony spurs. So the take-home message from this is remaining in one position is bad, movement is good, and my favorite expression, motion is lotion. Besides the breakdown of cartilage, osteoarthritis can cause deterioration of other tissues and structures in the joint, including the bone, the ligaments, which is what holds the bones together, the connective tissues, and the muscles. And it can also cause the lining of the joint to become inflamed, and often you'll notice swelling in an arthritic joint. Some of the common symptoms are pain, of course. That's usually the first indicator that something is changing in the joint. But note that the degree of pain may not correlate at all to the severity of your arthritis. You can have a very small change in the joint that can produce a lot of pain, and conversely, you can have a joint that looks really badly degenerated on an x-ray, but may produce hardly any pain at all. You may have pain that lasts just a few weeks and then fully goes away. Generally, however, constant and increasing pain throughout the day that continues for a long period of time may indicate that your disease is progressing. Stiffness is the other common symptom, especially in the morning when you first get out of bed or after you've been sitting in one position for a long time. Swelling around the joint is a sign that things are inflamed, and that may come and go. A feeling of instability can result from muscle weakness and damage that the inflammation inflicts to the supporting joint structures. The feeling that the knee might give way is really common, and it makes a person with osteoarthritis afraid to perform physical activity. With the inflammation and the changes, you might start to experience decreased range of motion, the inability to bend or straighten your knee as far, or in your hip, be able to reach down and tie your shoes. And that can result because you're afraid to move because of pain. It can result from swelling, and it can result from the bony changes that occur from the arthritis, and sometimes even a change in bony alignment. So for example, in the knee joint, you might start to notice that the knee bows in or out, so you become either knock-kneed or bow-legged, which is very common with osteoarthritis. As stated before, as a consequence of these symptoms, an individual is likely to move less, which causes more stiffness and reduction in range of motion, because the joint is not experiencing that dynamic load, which is so beneficial to the repair process. All right, the prevalence and the way you diagnose the osteoarthritis. Osteoarthritis is the most common cause of difficulties with mobility and disability in older people, but it's also common in younger and middle-aged people, particularly if you injured the joint earlier in life. 20% of the population over age 60 have symptomatic arthritis. In other words, they're experiencing pain or stiffness and such. 5% of people between 35 and 55 will show osteoarthritis changes on x-ray. They may or may not have symptoms. Osteoarthritis can be diagnosed based on your symptoms, or it can also be seen on an x-ray or MRI. Wes will now discuss the risk factors.
All right. So there's a few different things that we look at when we look at is someone at risk for developing osteoarthritis. And the first type of risk factor that we look at is called a non-modifiable risk. So what a non-modifiable risk means, this is something that we're not going to be able to do much about. It's not within our control or capacity to change. And of course, that first one is going to be age. So we know that risk increases with age. Approximately to 30% of the population between 50 and 70 years old are going to have some problems related to osteoarthritis, and that percentage is going to increase with age, meaning that the more we age, the more we become at risk. It can affect individuals younger, of course, as well, but again, it is most prevalent as we get older. When we look at gender, there is a difference between women and men in the prevalence. Women are at a slightly higher risk, although it's really not certain as to why women seem to have a higher prevalence. Also, men tend to get arthritis more often in the hips, whereas women seem more likely to experience osteoarthritis in the knees, as well as in the hands and the joints of the fingers. Another factor is genetics. You are more at risk if your parents have osteoarthritis. So again, this is going to be all different factors that are going to affect your chance of getting osteoarthritis that we do not have within our control. So when we don't have something within our control, it's important to know that, but it's not something that we want to dwell upon. Things that we do want to take a closer look at are modifiable risks. So modifiable risks are factors that are within your scope of control. And I'm going to put them all up on our screen here before I talk about them. So all of these factors you see on the screen right now are things that are somewhat within our control to try to affect, again, in a positive way. The first one is being above your target weight or having a BMI of over 25. So just a quick side that a BMI is your weight relative to your height. And if that number is anywhere between 18.5 to 25 based on the calculation, that's considered a normal weight as far as the World Health Organization bases the numbers off of. You just take your body weight in kilograms and you divide it by your height, which is in meters squared, and it will give you that number. Being overweight or obese is considered a risk factor due to extra and excess physical stress to the joint. So carrying more weight means that the joints have to sustain slightly higher forces than they would if you were of a normal weight. So because you're putting on excess or extra stress on the joint, it can increase the rate of the degradation, or again, the bad part around the knee that we don't want it to happen, or the hip, or again, the fingers as well. When we're talking about obesity and being overweight, this will affect the hip and knee more so than the hands. For every kilogram of added weight, the joint load can increase by up to 3 to 5 times. So besides having that factor, fat tissue can also produce proteins that cause harmful inflammation in and around the joint. So you're getting kind of 2 different potential stresses. Moving on to excess joint stress, which we touched on a bit, which can be a factor stemming from being overweight or obese, but also excessive or bad stress on the joint can come from sports or your job. And again, both of this excess stress can lead to diagnosis of osteoarthritis. It is important to note that movement and exercise can be helpful. And this is why it's important during both structured exercise sessions as well as during regular daily activities to try to maintain a good joint position during your movements. When the joints are optimally aligned, they're in the best position to absorb and positively adapt to stress. We are definitely going to touch on that very shortly when we get into exercises that can help manage osteoarthritis. Inactivity can lead to a breakdown of the joint structure. So without movement, the cartilage does not get that nourishment it needs to properly regenerate, like we touched on earlier. Bone and connective tissue quality deteriorates when there is reduced weight-bearing activity. So when muscle strength is reduced, the joint becomes more unstable and less controlled. So unfortunately, this is a vicious cycle where if our muscle strength is reduced and the joint becomes more unstable, we're even less likely to move. And the less likely we are to move, the more muscle strength will reduce and the more the joint becomes more unstable. So again, that's a cycle that we want to work hard to break out of. Sometimes a person experiences pain and they believe that activity can make it worse, but inactivity can actually lead to reduced health of the joint, again, resulting in more pain and activity. So this is why we want to ensure that we get good, healthy movement as much as we can. Last but not least, injuries, so such as those from playing sports or from an accident or, again, from occupational stresses. These can all increase the risk of osteoarthritis. Even injuries that occurred years ago and seemingly healed can increase risk. Some studies have shown that individuals who suffer an acute knee injury have a higher incidence of osteoarthritis 10 to 15 years after that incident compared to individuals who did not have an acute knee injury.
All right, let's talk about treatment options. This is on your screen, you'll see a pyramid. Meaning that the bottom level, where it says education, exercise, and weight control, that would be your first line of treatment, and that's a section that all people should start at this level, and then gradually as you go towards the tip, less and less people will need the higher up types of treatment. So for everyone seeking help for their osteoarthritis, we should start at the first level with exercise, education, weight loss if needed. We've already given you some basic education around that, and we'll elaborate a little bit further on the exercise. But studies have shown that strategies at this level can help with pain relief and can certainly help prolong the life of your joint and your ability to remain functional for the activities you enjoy for many years, even though you have osteoarthritis. If the first line of treatment doesn't provide enough relief, then you might move up to the second level. And that would include things such as medication and other therapies, such as those provided or performed by a physiotherapist, an athletic therapist, and a chiropractor. They might do things like heat, ice, electrotherapy, acupuncture, orthotics, shoe insoles, braces, and walking aids such as a cane or a walker. Medications include at first level, usually your anti-inflammatories, which is also called NSAIDs, N-A-S-A-I-D-S, and that would include your ibuprofen or Advil, naproxen, Aleve, Motrin, Voltaren. Those are all anti-inflammatories. Some people are offered pain relievers such as acetaminophen, which is also known as Tylenol. People have tried glucosamine, which they believe regenerates the cartilage, and cortisone shots, which they believe will reduce inflammation and pain. So here's what the reality is. Anti-inflammatories are recommended, and they're shown to be more effective than acetaminophen or Tylenol, but they can have side effects, especially on the stomach, and so they should only be taken for a limited time period. Cortisone injections can provide temporary relief, usually up to about 8 weeks if the joint is inflamed, but it's not recommended for most people with knee OA, and you can usually only have a couple in your lifetime before they cause more damage than good. Glucosamine has been shown to have no better effect than placebo or sugar pills. Finally, if your joint gets to the point where you're really in pain all the time, you're having difficulty walking, you're not managing your day-to-day activity, you might start to consider surgery. And only about 10 to 15% of persons with osteoarthritis will need to go on to this level. Unfortunately, surgery, while such as a joint replacement, so a total knee or total hip replacement, an osteotomy, which is a cutting and realignment of the bone, they can have very good success rates, but all surgery comes with a risk. And only 80 to 90% will experience some pain reduction. Some will have full pain relief, but unfortunately not everyone has full pain relief even after procedures such as that. Often you hear that people had a scope to clean out the joint, and they hope that that will give them several more years before they need a joint replacement, but they are now finding that it does not show any better or outcome than if the doctor just pretended to do that surgery. In other words, he made a cut and you believed that he did something on the inside but didn't actually. So, and on my experience with knee and hip replacements, particularly knee replacements, when they do this type of procedure, is that sometimes it makes the knee feel better for a couple of months, but then it deteriorates right back to where it was. All right, let's go back to that first level of treatment and provide you with some helpful strategies that can help you begin to self-manage your osteoarthritis. So we often hear that osteoarthritis is a wear and tear disease. So that means many individuals think that exercise means, well, if I'm exercising, have more wear and tear. So then I'm going to increase my risk to either developing arthritis or making my arthritis worse. Most people also believe that if I do an exercise and it causes me some pain, then that exercise must be harmful to the joint. Research has proven both of these beliefs are actually false. Studies have shown that exercise can prolong the health of the joint. Remember my saying from earlier that motion is lotion and helps hydrate the cartilage? And Wes mentioned that strong muscles provide stability to the joint. All of those things will actually slow the progression of your osteoarthritis. So exercise slows the progression as opposed to accelerating it. There's been studies that show that exercise is more beneficial for osteoarthritis than medication in reducing pain. But there's a qualifier. The exercise must be moderate, targeted, and performed correctly. So it's not just go out and exercise, you have to do it correctly. Stay tuned for a few exercises that will help those with hip and knee arthritis. Finally, nutrition can also impact your joint health. What you eat and how much you weigh can impact the progression of osteoarthritis. Read up on diets that can help. Neither one of us are dietitians, so we'll stick to our specialties, but talking with a registered dietitian could be helpful for you. Remember, even a small reduction in weight has a big effect on joint load. For every kilo you lose, the load is reduced by 2 to 3 times on the joint.
So by now, you may know the answer to this question, but am I able to exercise? And the answer is going to be, of course. We always want you to exercise because exercise can have a very positive effect on the cartilage. Again, we mentioned that dynamic loading of the joint. Consider it, again, nourishment for the joint. So exercise, when done well, can, again, effectively nourish the joint and again, help relieve some of your symptoms. Not only can it help with osteoarthritis, but being physically active also, of course, has a whole host of positive benefits that help reduce the risk of developing other chronic diseases that can result from inactivity. There are specific exercises that we use that can teach neuromuscular control. And again, like we said, it can help manage many other issues that we want to try to avoid. So when it comes to exercise, what type of exercise should we be doing? And there are many types of exercises we want to be doing. We're going to start with strength. Again, strengthening the muscles around the joint will definitely help increase stability and control. 99.9 times out of 100, there is nothing wrong with getting stronger. Getting stronger helps solve a lot of life's problems. So again, proper exercise is going to really help do that. So looking at big muscle groups, performing a lot of, again, slow, graduated, progressive overload in terms of strengthening that joint is going to help a lot in the long run. Flexibility, of course, helps maintain the range of motion in the joint. So again, too much stiffness in muscles around a joint is going to reduce its range of motion. So again, ensuring that we have adequate levels of flexibility and mobility around the joint can go a long way to helping ensure that we have, again, good, proper range of motion and motor control of that joint. Balance exercises can help. Again, you see a picture here of someone just balancing. They're on one leg. There's many types of balance exercises that can be helpful. Again, this can be done on one leg or with narrow stances or, again, with many, many different ways of unstable surfaces. But again, improving your balance is going to reduce your risk of falls, which is, again, very important, not only as we age, but for, again, protecting those osteoarthritic joints. And lastly, cardiovascular activity is going to be very beneficial. When you have osteoarthritis, especially in the hip or knee, you may find that certain activities feel better to perform cardiovascular activity. And then it's going to be things that you want to try, like walking, biking, or swimming. You want to try to find activities that don't aggravate your joint pain, but allow you to get your movement again. Again, while cardio activity, the dynamic loading can help nourish the joint. As you may know, cardiovascular activity has an extremely beneficial effect on the cardiovascular system and heart health. So it's definitely something we want to include in all different types of exercise routines. We're showing you some examples here on the screen of exercises that we do within the GLAD exercise program for osteoarthritis, which we'll talk about right away. Again, these are very beneficial. On the left, what you're seeing is a client using the large muscles on the back side of the lower half of the body to lift the hips in the air. So we're working muscles, again, on that what we call posterior or back side of the body that are very big, strong muscles that we want used. The image on the top is a level 1 exercise, and the bottom image with the leg raised in the air is a level 2 exercise. By raising one leg, you're putting a lot more work on the backside of the leg on the ground, as well as some of the inner core muscles. The image on the right demonstrates what we call a lateral slide, and we're actually working on the non-sliding leg in this one. The non-sliding leg has to work to maintain control as the leg slides out, then has to have some strength to push the body back up to a standing position. This is a great example of an exercise that requires what we call neuromuscular control. Here's a little bit of a close-up of how we want that joint to look. So even though this person is doing a slightly similar but different exercise where the leg is behind rather than to the side, if you look at the joint from the ankle to the knee to the hip, this is an example of a good loading pattern that we want to see. So if you notice from that hip, knee, and ankle, you could draw a straight line if you drop from the hip all the way down to the ankle, keeping the joints in what we call this stacked format like this. It ensures optimal loading patterns. So if this individual were to have their knee cave in to the left of your screen and they were off that line, that straight line from hip, knee to ankle, that would place the knee under a little bit more excessive stress. So this is things that we look for during the exercise programs. And again, this is just one example, but this concept of stacking the joints goes to many different exercises, not just this one or that leg sliding one that you saw before. So again, this is where having a good coach can really help ensure that you're performing your exercises correctly. So again, you can achieve the best possible outcomes.
All right, but what about pain? It hurts when I do my exercise. Should I continue? Some pain with osteoarthritis is normal, but it's not necessarily harmful. So the key is monitoring the level. If you look at the scale that's up on your screen, it shows 0 as being no pain and 10 being pain as bad as it could be. If your pain is in the 0 to 2 range, exercise is considered safe. When you get up to even up to level of 5, which would be moderate pain, you can still exercise, but you probably have to start to become a little bit more cautious, and then your exercise becomes a little more high risk as you proceed towards number 10. So what we'd like to do is have a general rule of thumb is that you rate your pain prior to your exercise. Let's say your pain is 2, and you begin to do an exercise such as the one that Wes showed you that was with a sliding motion, and you notice that your pain increases to a 3, that means that exercise is fine for you. If it increases to a 4, it means it's starting to get a little bit more touch and go, and probably at that point you would stop and you would just move on to a different exercise, but not stop exercising altogether. Now, so moving up to 1 or 2 points beyond where you're starting is generally considered safe. And that's even true if you, let's say you start at an 8 out of 10 exercise out of pain when you're doing your exercise. Let's say your pain stays at 8 out of 10, or it maybe increases to 9 out of 10. I would still let you go ahead and do that exercise. If it became worse than that, then we would stop. Another really important rule with pain is that your pain should return to your usual baseline by the next day. So you might be a bit more sore on the day that you do exercise, but by the next morning, it should generally come back to about the same level as it is every day. If it doesn't, it might mean that you've overdone it a little bit. So don't stop, maybe take a day off, do the exercises again, but maybe don't do as many, maybe reduce the range of motion in which you're doing it a little bit. And then monitor how you are the next day, and if that's okay, then gradually increase from there. Now we'll talk a little bit about the GLAD Canada program. Some of the best evidence that we have for the benefit of exercise for osteoarthritis is from a program that was developed in Denmark, and it's called GLAD, which stands for Good Living with Arthritis, and the D stands for Denmark. It's a specific education and exercise program in which over 13,000 people in Europe have participated. And they track all of those 13,000 people as to the outcomes, where they started and how they finished. And the study results show that participants experience less pain, better physical function, and a better quality of life even a year after the program finished. Fewer people had to take painkillers. In fact, 1 in 3 stopped pain medication altogether, and fewer people took time away from work. This program has now been brought to Canada, so it's called GLAD Canada. Instructors have to have specific training. You're not allowed to deliver the GLAD program unless you've been trained by the GLAD Canada group. And there's many sites all right across Canada that now offer the program, and that includes the Wellness Institute. In order to participate in the program, you don't need a doctor's referral, and you don't need x-ray proof of having osteoarthritis. Usually your pain symptoms and age and those sorts of things are usually enough to show that you likely have arthritic changes and you would benefit from the program. For more information, go to the GLAD Canada website, and they'll explain more about the program there, and they'll also show what sites are close to you.
So just to give you a brief overview of what's included within this GLAD Canada program is 2 to 3 education sessions or classes, and we expand on the what and the why. So again, what is osteoarthritis? Why did I get it? And how can we improve? Again, we'll expand on a lot of those topics that we touched on in today's webinar. Additionally, we have 12 exercise classes where we go twice a week for 6 weeks. As you've seen from some of the examples, we want to learn safe exercises to help build strength. So again, over 6 weeks, we just gradually increase the difficulty, increase the loading to help improve that joint integrity. The goal of the program is also that you want to use the knowledge you've learned to increase what we call ADLs, or activities of daily living. We want you to graduate from the program knowing safe, effective ways to continue your exercise on your own, knowing that you are doing the best you can to, again, maintain your joint health. So we just want to finish off today with some key takeaways for today. We hope that you learned more about the disease and ways to manage and possibly improve your symptoms. Mostly, we hope that you learned that being physically active actually helps to slow the progression, reduce pain, and improve your function. So our key takeaways is that osteoarthritis is a common condition that affects many people. Self-management techniques have been shown to reduce symptoms and slow progression. Again, physical activity and dedicated exercise sessions within tolerable pain limits, and also, of course, when done well, are going to be your best bet to do so. And the GLAD program is based on a successful intervention, and that's kind of the model that we are using here at the Wellness Institute. Remember, as Dorothy mentioned earlier, remaining in one position is bad, movement is good, and motion is lotion to the joint. Again, if you'd like to learn more about the Wellness Institute and the GLAD program specifically offered here, you can contact us at any of these areas, again, with our phone number, our email, or you can visit our website to learn more.